Ward 86 is a special place to me because we take anyone who walks in with a need around HIV, whether that's a prevention need or whether that's a need for treatment, and we try to do our very best by them. And additionally, and equally important and sometimes more important, we try and do that in a really caring way. So if they have other things going on in their lives, like addiction, like mental illness, like homelessness, like isolation from others, that sort of thing, we try and address those issues too.
I currently spend a lot of time of my workday working with people who have HIV and hepatitis C. And I was very proud, many years ago, I was very proud to help a 39-year-old gay Mexican-American get a liver transplant when he had started out homeless and was going to die from liver failure or liver cancer. And the entire community came together to get him housing, to provide round-the-clock care, and get him a new liver. He's now working as a health attendant, and that was 8 years ago. I'm very proud of those moments.
I recently met a young man who was brought in through this program, through this RAPID program, who had just received his HIV diagnosis that very day, and the testing site had called over to our social workers and then sent him over because he was willing to be seen that same day. And he was completely distraught, as you might imagine. I mean, this was the worst news he'd ever gotten, the worst day of his life. And through the care that he got that day, both the social work care and the nursing care and the physician care, and then starting on medications for his HIV that very day, he was able to turn, I think, that horrible day into a positive action, to go forward, knowing that, yeah, he has HIV, that's not a good thing, that's a life-changing thing, but that he had already taken action on that and begun to turn his health in a really good direction.
I'm also very proud of a woman that I know who survived 25 years of homelessness with her abusive partner. Said the day she told him she was HIV positive, he started, treating her really violently, both verbally and physically. And she now is housed, growing old, reconnected with her daughter, with her granddaughter, and has survived lung cancer. And we're going to cure her of Hep C next.
My patient is transgender. She is from the South. She is African American, and her partner was my patient as well. And her partner died at 35 after having an incredible struggle with lots of other medical problems. And I am, this patient and I we are intimately involved. And what I mean by that is, she texted me at 3:47 in the morning in February when her partner died. I am involved so intimately with this patient that I know every step of her grieving process. My patients are in my life, like my family's in my life, like the people in this division, like the people in Ward 86 are in my life. I want to be the person the first person that they may want to call.
I think stories connect people so much more vividly than do medical statistics, right? So I could tell you how many infections are happening each year in San Francisco and how many deaths and so on, but just hearing about a couple of people who are living with HIV or who are either managing their infection or managing to prevent infection, I think can be so effective at letting the broader public, the supporting public, the donor base, etc., know about the important and great work that we're doing here at Ward 86.
I'm honored to be here, to be able to be an HIV doctor here.